Hello everyone, my name is Nyasha Mandu from Zimbabwe, and here with me here is Leon Tadiswa Shumbairerwa. My son is 5 years old. Leon was diagnosed with established liver cirrhosis in 2021 back in our country there in Zimbabwe, and he was using oxygen 24/7. It was really a tough journey for us, me and my family, because every day seeing him on oxygen, buying the oxygen was quite expensive. So he was actually using 10 liters per minute. So we were referred here to India to Dr. Giriraj Bora and Dr. Sakshi.
Master Leon is a 5-year-old boy from Zimbabwe, and he was living a life just like any other boy of his age till October last year. And unfortunately, during the COVID time, he developed sudden respiratory distress, and on evaluation it was found that in fact the problem was not within the lungs, and he was suffering from a real complication of liver cirrhosis, which is known as Hepatopulmonary Syndrome. So what was happening is that the boy was requiring 10 liters of oxygen per minute in order to maintain his saturation, and in fact, in spite of use of such high oxygen, his saturation, the blood gas saturation was with oxygen was as low as 60%. So the boy was crippled. He was unable to perform his day-to-day activities, and in fact, even when he was eating, he was requiring oxygen.
Complain of chronic liver disease and was diagnosed to have hepatopulmonary syndrome. Now, hepatopulmonary syndrome basically it's a lung complication of chronic liver disease. Chronic means a liver disease which is present for a long time. Then there are some basic complex relationships between diseased liver, and they tend to have lung complications in form of hepatopulmonary syndrome. So these kids, they present to us basically with shortness of breath, they have blue nails, their oxygen saturation is low, and this all happens because of some abnormal shunts which forms in the lung as a result of chronic liver disease.
So when we came, they said they did so many tests on him, and they said his condition was established liver cirrhosis and portal hypertension. And they said his chances of survival was 70%. So we had to discuss this with my family because they gave us two options. The first one was to go back to our country, going back to Zimbabwe and using oxygen for his entire life, or we could take the chance of taking this risky operation because he had developed a shunt which had a high fraction.
So when we evaluated the boy here in Artemis Hospital, what we found that almost 68% of his blood was bypassing the lungs, and the entire deoxygenated blood was going into his systemic circulation. So we had a detailed consultation, detailed counseling of the family that it's a high-risk operation, and we are expecting a prolonged hospital stay, need for mechanical ventilation, and use of a special gas nitric oxide in case we are unable to maintain his blood gas oxygen saturation after the operation.
Oh, they said like for a normal liver transplant patient, chances of survival are 5%. But for him, because of this complication, his chances were 30%. So we had to take this risk.
Now, as of now, till date, there is no adequate medical treatment for this, and only answer to this problem is liver transplantation. So after a successful liver transplantation in these kids, most of the complication, most of these lung issues and abnormal shunts and low oxygenation, this all improves over a period of time, which can vary between few weeks to few months.
He had the surgery. I would like to thank the doctors. It was a successful surgery.
Somehow there were no complications with Leon, and he actually came out of this period within next say 2 to 3 weeks. He was actually discharged on oxygen 3 liters by face mask.
He got treated and was discharged after 3 weeks, and he was still using oxygen.
So this was one of those most rare and pleasant moment in a doctor's life when he or she feels that all the hard work and toil is worth it. Leon's case was such an example for us. I was involved in the post-operative management in the pediatric ICU, and because of his liver failure, there was a rare and challenging complication that has affected his lungs, and he was dependent on oxygen for many years in the past. So after liver transplant, he was on ventilator support requiring very high oxygen, and to tide over that period, we needed a special support of nitric oxide gas that helps in improving the oxygenation. It was a very challenging period for all of us, as it was being very difficult to maintain his oxygen level at that time. But with God's grace and continuous support and the whole teamwork that dedicatedly worked for him whole day and night, gradually things improved. He remained on ventilator support and nitric oxide support for more than 12 days in ICU, and gradually we tried to keep him without infection and tried to maintain his nutrition level with all those support, and things started improving.
I'm overjoyed. I'm so happy that now he's okay, because the journey was a tough one. My family, they're also happy. They can't wait to see him, because it really has been difficult for everyone, seeing him on oxygen, not being able to go out and play with other kids. But now things have turned around. He's now okay, playing, doing all things. I'm just so happy. Can't wait to go back to my country with him walking on his own, no more wheelchair, no more oxygen.
So it's almost 45 days after his operation, and Leon is not requiring any oxygen now and is living his life just like any other boy or the girl of his age.
So I would really want to thank my government for the opportunity that they have given me. My son was given a second life. It was difficult, so through the intervention of the government, we were able to come here for the treatment. I also want to thank the well-wishers, because back then, because of my poor background, buying oxygen every day, it was difficult. So many people helped, many people contributed for Leon's oxygen. So I really want to thank everyone. I'd like to thank my family for standing with me, for the support, for everything. They've been there for me. I would like to thank my uncle, who was the donor. I would like to thank Dr. Giriraj Bora and Dr. Sakshi and their team. They worked so hard. I was at peace knowing that my son was in good hands. So I would really want to thank them, and I know God was leading them in this whole procedure, and it went well. Everything was perfect from day one. No complications, nothing happened. So I really want to thank them. for everything they did for my son.